Hey y'all, my name is Abby Torregoza, and my project is on the syphilis epidemic among gay, bisexual, and other men who have sex with men in Baltimore City. Here's what I'll be explaining in my presentation, starting with the background. So a little bit about my topic to start with. Sexually transmitted infections, also known as STI, including syphilis, have recently hit an all-time high. Nationally, men who have sex with men account for most of the syphilis cases in 2017. And in Baltimore City, the overall rate of syphilis has increased since 2009. In this figure, it is evident that the overall number of syphilis cases in Maryland has increased from 2013 to 2017. Also, the number of cases among men who have sex with men are significantly higher than those among women and men who have sex with women. Something to consider while interpreting this figure is the population sizes of each of the depicted groups. Given that the population of men who have sex with men is smaller than that of women and men who have sex with women, the concentration of syphilis among men who seek men is much higher in comparison. Syphilis is transmitted sexually, meaning through the anus, vagina, or the mouth. It is caused by the bacteria Treponema pallidum, and it is diagnosed through a rapid plasma reagent test. Testing and treatment for syphilis has not changed since its development, and what's so special about syphilis is that it has no resistance to antibiotics, meaning that through effective intervention, it can be eradicated completely. Here are the stages and corresponding symptoms of syphilis. It is normally diagnosed in its primary or secondary stage where physical symptoms occur. Symptoms disappear in the latent stage, which might cause one to believe that the infection has gone away, but the infection is still present in one's system. Up to 30 years after the initial infection, though rare, syphilis might develop into its tertiary stage, where it can cause fatal brain and organ damage, which can result in death. Men who have sex with men are a priority population due to risk behaviors such as illicit drug use during intercourse. In one population, methamphetamine has been found to be associated with sexual risk behaviors. In another, meth has been associated with HIV rates, which can be co-transmitted with syphilis. Chemsex is the deliberate use of often illicit drugs before or during sex in order to enable, enhance, or prolong sexual interactions. This term chemsex is commonly used in Europe and Australia, but it can be referred to as party and play or high and horny in North America and other parts. It is prevalent during intensive sex partying, which entails sex and drug binging that may span several days. Drug use, especially recreational, during sex is seen as a risk behavior. Among those recreational drugs is methamphetamine. Methamphetamine is an addictive stimulant, which can be snorted, smoked, or injected. It is used in chemsex to enhance pleasure, but also to reduce inhibitions. This may mean alleviating dysmorphia, improving one's confidence, and reducing the guilt one may have about his sexuality. Methamphetamine may make it difficult for a person to stay erect, so he is most often the receptive partner. This poses the risk for being subject to microtears around the anus, which increases one's susceptibility to infection. Data from cities along the West Coast shows an increase of syphilis cases in meth-using men who seek men compared to non-meth-using men who seek men, so I hypothesize that the same will occur in Baltimore as well. My study aims to 1. Determine the prevalence of syphilis among men who have sex with men, 2. Determine the prevalence of illicit drug use, specifically methamphetamine, and then 3. Determine the association between illicit drug use and syphilis infection. In order to meet these aims, I will be using data collected from the UShine study to explore relationships between methamphetamine and syphilis by performing a statistical analysis. Understanding Sexual Health and Networks, also known as UShine, is an ongoing longitudinal study that follows patients for a period of time to observe and understand how STI are transmitted. UShine is a 3-site study, but I will be focusing on data from Baltimore. Data is collected from 3 clinical sites: Chase Brexton, 2 Baltimore City Health Department clinics, and also the Pride Center. To qualify for participation in the study, individuals must meet all of the following criteria: 1. Be a gay bisexual man who has sex with men, 2. Be 18 to 45 years of age, and 3. Live in Baltimore City. Participants will receive compensation each time they visit a clinic for the study and for recruiting additional members. Along with that, they will be tested for HIV and these STI. I am mainly going to focus on syphilis. A COSI, also known as an audio computer assisted survey, is going to be used to collect data of individual demographics, sexual behaviors, and drug use behaviors. UShine collects a lot of data, but I will be focusing on the data pertaining to my research. So, methamphetamine, syphilis, and sexual risk behaviors. I will be using R version 3.6.1 to create a summary of my population, including their demographics and drug and sex risk behaviors to meet my first and second aims. With that, I will be able to complete a bivariate analysis to meet my third aim. In that analysis, I will be seeing how methamphetamine use, my X variable, impacts syphilis cases, my Y variable. This will allow me to answer my speculation that there may be an association between methamphetamine use and syphilis cases in Baltimore City. Statistical testing is to be conducted using chi-square and statistical significance based on a p-value of less than 0.05 as is standard in epidemiology. Here is a template of what would be my population summary, including factors such as age, race, ethnicity, and sexual identity. Here are the characteristics I'm exploring that are specific to my research. I have sexual risk behaviors including total number of sex partners, sexual positioning, and transactional sex. And for drug risk behaviors, I'm just looking for methamphetamine use. Just like all research, mine has its limitations. The limited number of data collection sites in the sampling method might not accurately represent the population. Participation is voluntary and incentivized, which might make people more inclined to be part of the study than if it were not the case. There are topics on the audio computer assisted survey in which participants might not feel comfortable being honest about, such as sex acts and substance use. Because much of this data is private health information, I cannot perform analyses outside of lab. Not everyone would like to have their sexuality and infection status made public. UShine puts securing participant data first with a certificate of confidentiality. It is important to deal with epidemics in general, especially when the number of cases is increasing, before the rate of infection starts to increase further. Syphilis cases in Baltimore are rising among men who have sex with men. Participation in chemsex and use of methamphetamine have been associated with risk behaviors which have been found to put people at a greater risk for STI. Understanding the syphilis epidemic and how infections are transmitted can be used to strategically plan public health interventions to treat and diagnose high-risk individuals, especially men who have sex with men, and ultimately eradicate syphilis. So that's all for my video. Please drop a like and hit the subscribe button down